Your body sees plaque as a foreign substance, so an inflammatory response begins. If plaque is allowed to remain on the teeth long enough, tiny blood vessels form to deliver healing blood to the infected area. This blood vessel growth causes the gum redness and swelling, and is also why inflamed gums bleed so easily. Swollen gums create a plaque trap, causing even more plaque to collect. As the gums swell, the pocket around the teeth becomes deeper. Your dental professional may use a periodontal probe to determine gum inflammation level. A healthy pocket depth is 3 millimeters or less. Deeper pockets need to be given attention by your dental hygienist. Since your gums cannot remove plaque naturally, the only way to halt gingivitis is for your dental professional to remove the plaque. This is done by scaling and polishing your teeth, allowing your gums to return to their tight, healthy state. The pockets around your teeth should be 3 millimeters or less. Tight gums surrounding your teeth make it easier to keep your mouth clean. On the other hand, if gingivitis is left unchecked, it can lead to loss of gums and bone, a condition called periodontitis. Your general health can be improved as well because your body will not be fighting off infection caused by plaque. Regular brushing and flossing and regular dental office cleanings are the most effective and least expensive way to maintain your teeth and gums. Remember, plaque has a hard time adhering to clean teeth. If you are looking for a way to replace a missing tooth that is most similar to a natural tooth, an implant may be a great option. An implant is a root-shaped titanium post that is placed in the bone, to which a crown is attached. An implant can look and act like a tooth you were born with. Not all situations allow implants. Initially, records such as X-rays, CT scans, tomography, and MRI may be collected to ensure the success of an implant. Determining factors include location, quality of bone, oral health, smoking, and genetics. Once it is determined that an implant can be done, preparation begins at the site. A hole is made in the bone. Then the titanium implant is threaded into the hole. Once in place, the implant may be covered with gum tissue and allowed to heal. After the gum heals, an incision is made and the crown base, called an abutment, is attached to the implant. Depending on the type of implant, an impression of the abutment may be taken to create the crown that would be fitted onto the abutment to complete the implant. Once created, the crown is attached to the abutment. The completed implant can now be used like a normal tooth. It may seem so natural that you will forget that it is not your original tooth. How long do implants last? Multiple factors determine the life of an implant, many the same as those that determine whether a site is eligible to receive an implant. Some implants can last a lifetime. Remember, implants do such an amazing imitation of a real tooth that they even require the same attention as a regular tooth. The implants that have the best chance of long-term success are the ones that are given the best care. So keep brushing and flossing. Periodontitis is a very common infection of the gum and bone surrounding the teeth. Most people who suffer from periodontitis are unaware that they have it until a dental professional brings it to their attention. Many factors are involved in its formation, but the most common factors are oral hygiene, smoking, diet, genetics, and stress. When plaque remains on the teeth, the gums and bone can react. If left untreated, the inflammation caused by the reaction to the plaque can eventually affect the tissues that hold the teeth into the bone. While gingivitis only affects the gums, periodontitis affects the attachment of the teeth to the gums and bone. In periodontitis, the gums produce hard deposits on the teeth called calculus. As calculus forms, Gums try to fend off this foreign matter with an immune system response. This creates the red gums that can, but don't always accompany periodontitis. As the gum and bone change, a pocket forms around the teeth. A periodontal probe is used to measure the pocket depth. If the pocket is more than 3 millimeters deep, it may be next to impossible for you to clean out the pocket to maintain a healthy gum situation. To stop this destructive process, it is necessary to treat the affected areas. This treatment usually starts with root planing. A careful cleaning of the root surfaces below the gum line where the battle is taking place. Once the irritating calculus and plaque are removed from the teeth, the gums often heal. This can only be accomplished if teeth remain clean, with meticulous and diligent brushing and flossing, and regular dental hygiene appointments. Despite root planing, chronic inflammation may have caused gums to become thick and calloused. Removing some excess tissue may be necessary to allow the gums to function normally. This is called pocket reduction therapy. Healthy gums can be maintained more easily with pockets of 3 millimeters or less. Chronic inflammation may have also damaged the bone, creating bone loss and irregularities. This type of bone condition may require a procedure to smooth out the surfaces or replace bone in order to provide a healthy gum foundation. This procedure is called bone recontouring. The immune system response to calculus can release chemicals that cause the bone and gum loss that accompany periodontitis. Without intervention, this degenerative process can continue, with the bone going and going and going until there may be very little bone left to support the teeth. If the periodontal condition is left unchecked long enough, the teeth will become loose, and what bone is left will no longer be able to keep the teeth from falling out. Although periodontitis can be very damaging, with proper treatment and excellent home care, it is possible to keep teeth that might have been lost to periodontitis. Your dentist can provide you with more information to help you maintain good oral health. Root canal therapy is an excellent and common treatment if a nerve in your tooth is damaged for any reason. Contrary to common perception, root canal therapy does not have to be an uncomfortable experience. Causes of nerve damage include tooth decay, a broken tooth, a large filling, crown preparation near the nerve, or trauma. Once the nerve can no longer heal itself, root canal therapy may be the only treatment option available to save the tooth from extraction. Once a nerve dies, bacteria may infect the canals inside the tooth that the nerve occupies. Multiplying bacteria can overflow the canals. Your body fends off the invasion. This tiny battle may cause many cell casualties that can result in the formation of an abscess. The nerve death and the buildup of pressure in the abscess can result in pain and may push the tooth slightly out of its socket. For this reason, patients often complain that the painful tooth is the only tooth that touches. The body cannot clean the bacteria out of the root canals by itself. Root canal therapy thoroughly cleans the canals of irritating bacteria using a cleaning instrument. Then the canals are filled with a sealing material and a temporary filling is placed on top. Once the cleaning and filling have been done, the infected area usually heals quickly. However, there may be some discomfort for a few days before the area feels more normal. The next step is to permanently repair the tooth by replacing the temporary with a permanent filling called a core. In finalizing this procedure, it may be necessary to install posts in the canals to support and strengthen the core. Finally, A crown covers the entire area to provide a protective shell for the tooth. The final repair steps must be completed, otherwise a tooth treated with only the root canal procedure may need to be extracted because of recurrent tooth decay or a fracture. Root canal therapy can save a tooth that would otherwise have to be extracted. Though often costly, root canal therapy can be much less expensive in the long run than the treatment options available to replace a lost tooth. Provided that the root canal therapy is successful and the follow-up repairs are completed, a root canal treated tooth can provide many years of service. Sometimes circumstances create a situation in which more than just a couple of teeth are missing in a variety of different patterns. In these cases, the treatment options include leaving the mouth as is, creating fixed bridge work, providing implants, or fitting the patient with a removable partial denture, often referred to as a partial. A partial denture is a precision appliance that attaches to and uses the remaining teeth and often the gums to support the forces of chewing. A partial is usually composed of gum-colored acrylic, which supports denture teeth that attach to a metal framework. Partials require a good foundation that may include replacing some fillings or building new crowns. Supporting teeth must be prepared to accept the partial framework. Tiny indentations called rests and other preparations are made in the load-bearing teeth. Once the rests are made, an impression of the teeth and gums is taken. A model is then created from this impression on which the partial framework is built. Once the framework is made, teeth and acrylic gums are added to complete the partial. One way to keep the partial securely in place is to use a special precision attachment. This type of attachment is not visible and requires crowns to support the partial. Another type of retention uses clasps to hold the partial onto the teeth and uses rests to support the pressure from chewing. A third way to keep the partial anchored employs implants. This could be more expensive, but will provide stability that may not be available otherwise. Once completed, your partial should fit snugly and comfortably. It is important to keep your partial clean and to make sure it is never dropped or mishandled, as this may bend the clasps that hold onto the teeth. A partial is a simple, cost-effective, easy to maintain, and long-lasting solution for multiple tooth loss. It is important to have your partial regularly checked for fit and wear. With proper care and maintenance, a partial can provide many years of trouble-free service. Enamel is the first line of defense for your teeth. It is the hard, outer protective layer that covers the more vulnerable dentin and nerve. There can be troublesome spots in the enamel, however. Sealants are used to help maintain the integrity of the enamel by sealing these spots. The surface of the back teeth can be quite irregular with peaks and valleys, crags and chasms. In fact, many people have narrow grooves on the top of their back teeth that can extend very deep into the tooth. Sometimes these grooves widen below the tooth surface and create voids. Sometimes they go all the way through the enamel to the dentin. Besides grooves, enamel can have other imperfections as well, such as pinhead-sized holes. Grooves and other deep imperfections can present quite a problem when trying to keep teeth clean. Bacteria and food can get into them, forming plaque and creating cavities. To prevent this from happening, the various fissures need to be closed off with a sealant. Grooves occur naturally, and the problems they cause have little to do with dental hygiene. No amount of brushing or flossing can defend against these problems. That can only be done with the timely application of sealants. Preparing a tooth for a sealant requires the removal of much less tooth than when filling a cavity, and can prevent larger cavities from forming. Before the sealant is applied, the groove or other imperfection has to be cleaned out and given a more regular surface. This is often done with an air abrasion process that uses a tiny sand blaster. Or a tiny round burr is used to clean out the area to give it a more regular surface. Before it is cured, the sealant is a fluid composite. As it is placed, it can flow into the tiny grooves, sealing them from the bottom up and locking out cavity-causing plaque. When the procedure is finished, the sealant will be indistinguishable from the rest of the tooth. Under the right conditions, your sealant can last indefinitely and will constantly be protecting the grooves from your teeth's greatest enemy, plaque.
Algunas veces los dientes se pierden. Aunque la pérdida de un diente nunca se puede reemplazar naturalmente, hay algunas opciones para corregir el problema. Una de estas opciones es un puente. Otras opciones son una corona o un diente parcial. En la ausencia de un diente en un espacio vacío, dientes vecinos pueden empezar a llenar el espacio. Ellos pueden empujarse desde la parte posterior o inferior o inclinarse desde los lados. Un puente puede prevenir que esto ocurra mientras provee un nuevo diente para masticar y completar así tu boca nuevamente. Un puente consiste en un diente falso, llamado un pontic, y las anclas que lo soportan. La estructura completa se extiende sobre el espacio vacío que dejó el diente perdido. Para hacer espacio para el puente, los dientes necesitan prepararse primero. Una cantidad igual de estructura es removida de cada diente. Una impresión es tomada y enviada al laboratorio dental, en donde el puente es construido. La parte estructural del puente es creada con una aleación de metal muy fuerte, anticipando la presión del mismo. El diente de porcelana se fusiona a la estructura. Una vez que el puente ha embonado correctamente en el espacio, el puente se adhiere al diente. El